So in this video, I'm going to talk about middle meningeal artery. So what is it a branch of? It is a branch of the maxillary artery. Maxillary artery has three parts that is divided by a muscle called as lateral pterygoid muscle. So the part proximal to the lateral pterygoid is called as the first part. The second part lies deep to the lateral pterygoid muscle, and the third part lies further from the lateral pterygoid. Now this maxillary artery consists of three parts, right? From the first part, the middle meningeal artery arises. Okay, it arises from the first part of the maxillary artery. Regarding the middle meningeal artery, you should know about the two terminal branches first. Okay, so the anterior branch of middle meningeal artery is called as the frontal branch. This is very, very important because it lies immediately deep to the pterion. What is pterion? It is the place in the skull, a landmark in the skull where four bones meet. What are all the bones that meet in pterion? The bones are frontal bone, the greater wing of sphenoid, parietal and temporal bone. These four bones meet at a H-shaped junction called as pterion. Just immediately deep to that, we have the anterior branch or the frontal branch of the middle meningeal artery. This artery is important because any injury to the pterion at that level, any blunt force trauma to there will lead to hemorrhage from this artery. That hemorrhage or hematoma is called as epidural hematoma. So this is the important branch that is related to clinical anatomy. From the pterion, it traverses towards the precentral gyrus. Precentral gyrus is present in the frontal lobe. Okay, from the pterion, it traverses towards there. So that is the first branch, the most important branch of the middle meningeal artery. The second terminal branch is called as the posterior branch or parietal branch. This part is related to the squamous part of the temporal bone. From there, it approaches towards the anterior aspect of mastoid angle of parietal bone. So, in the skull bones, we have the frontal, parietal, temporal and occipital. These are the major bones. For the parietal bone, it has an angle called as the mastoid angle. In the posterior inferior aspect, it has a mastoid angle. That is where this parietal branch approaches. So, the second branch is the parietal branch that reaches towards the mastoid angle of the parietal bone. The other branches related to middle meningeal artery are petrosal branches. Okay, petrosal branch in turn splits into two important branches called as the superior tympanic branch and cavernous branch. Okay, so even if you don't remember any other branches, the two terminal branches are very, very important, which is the frontal branch and parietal branch. Among this, the frontal branch is related to pterion, blunt force trauma and thereby to epidural hematoma. The next important branch that you should remember is the petrosal branch. This in turn splits into two branches called as superior tympanic and cavernous branch. The other branches are temporal, anastomotic branch and a ganglionic branch to the trigeminal ganglion. So these are all the branches from middle meningeal artery. What are the areas supplied by the middle meningeal artery? From the name itself, it is meninges as well as the skull bone are supplied by this artery. One important thing about the middle meningeal artery is it is surrounded by the two roots of auriculotemporal nerve. Okay, here at this junction you can see it is surrounded by the two roots of auriculotemporal nerve and then it enters the cranium through a foramen called as foramen spinosum. Okay, this foramen spinosum is present in the middle cranial fossa and there are two structures passing through this foramen. The first one is the middle meningeal artery, second one is nervus spinosus. These two structures pass together in the foramen spinosum. So, related to the middle meningeal artery, it emerges from the first part of maxillary artery. It goes deep to a muscle. The muscle name is called as lateral pterygoid and It is surrounded by the two roots of auriculotemporal nerve. Then it enters the skull through a foramen called as foramen spinosum, where it is accompanied by nervus spinosus. The two important terminal branches are frontal and the parietal branch, and the other important branch is the petrosal branch. So this is about the middle meningeal artery. Thank you.